Moira Wong Orthodontics
presents Miss Catarina and Dr. Moira in a jaw surgery journey. How is a facial asymmetry identified? Who is the first person to notice it, and at what age?
The parent will know if their child is growing off to one side. And I have children very young, 2-3 years old, and parents bring them in and say, he wasn't like this before, and he is like this now. And I've noticed that it's developed over the last 3 months. And when I look at my phone and all these photographs, parents will know straight away if their child has an asymmetry, because the chin point goes off to one side, and the mother will notice before anyone else.
So what was Catarina's case? Why did she need jaw surgery?
So when I first met you, you presented with a facial asymmetry. Your lower jaw had grown off to one side, and I think it was the asymmetry, and your lower jaw was longer than normal. So there's been excess growth, so the lower jaw had come forward, but it had come forward to one side. And that was because you were missing a muscle on one side, so there was more growth on one side than the other side. And this is what led to what we medically term a facial deformity. And I noticed when you came in that you would tilt your head to one side, which is something you weren't aware of, but to almost balance the asymmetry. And so you would hold your head in a certain position so that when someone was looking straight on, it would mask a little bit the asymmetry.
If a parent notices asymmetry in their child's face, is there something they can do?
I think that monitoring is a big part of the treatment. It's not actively starting treatment, but monitoring to understand when it started. It tends to accelerate during adolescence because you get more growth during adolescence generally of all the long bones in the face. And I don't know if that was the case with you, but it tends to become more obvious during adolescence. Did you find that it became more prominent, the deformity?
Yes, definitely.
During those teenage years?
Yes, when I was a kid, I mean, in pictures and everything, we couldn't tell that there was an asymmetry. But as I got older, definitely the asymmetry was way more obvious. Yeah, definitely.
So I think when parents are aware of it, it's good to seek a consultation to get a diagnosis. Because in Catarina's case, she was missing a muscle. There are many different causes of this. And so the main thing is to get a diagnosis. Once you have a diagnosis, you can work with a treatment. And timing will vary depending on what the cause is. But as a general rule, we have to wait for it to burn out its growth, because it tends to worsen with growth, which is why, correctly so, your orthodontist, when you were really little, said when she's 18, because it's a kind of guide for girls. Some boys take longer to grow, and boys will have the treatment later.
Did the missing muscle affect your health in any other way apart from the facial asymmetry?
So because I actually went to, I had an appointment for, I can't remember now the specific name of the doctor's.
ENT? Ear, nose and throat?
Probably, yeah. Not quite sure.
That's okay.
But yeah, it's fine. So, and because I had a shoulder that was quite unbalanced in relation to the other, in which go like this, so the shoulder comes forward a lot more than this one, and on the back you can tell like one bone sticks out way more than the other bone. So yeah, so that's what prompted me to go to seek doctor advice, and then he started to like see my neck and here, and he realized that I didn't have this muscle because I have this one. But
it connects from the skull across to the clavicle, and the clavicle clearly connects with the shoulder, and all this area connects with the skull. So when there's it has kind of like a domino effect on the other parts that it links to, right?
Yes. And that's how we start to realize that there was something off. It wasn't so much the face, because we never, connected one thing to the other. Maybe after I knew that the muscle was missing, but before that, no, it was more like my posture and
So you worked on your posture at the time, and did it affect you in any other way, like breathing or chewing?
Breathing, yes, and also chewing. I mean, your occlusion.
Yes.
If you look at, because the whole jaw is off to one side, so she only had contact on. It's a little bit like walking on stilettos, no?
Mm-hmm.
When you have a good bite, everything's contacting, but when the whole jaw is off to one side, there's only certain teeth that are hitting each other, and so you're trying to chew with 3 pairs of connecting teeth instead of all the teeth touching each other. So for sure.
But that was because of the jaw, not so much because of the muscle itself that provoked that problem, right?
But the jaw was because of the muscle.
Yes, correct.
So it's the domino effect. The muscle affected the growth of the jaw carries the teeth, and so there's a mismatch between top and bottom jaws. So chewing efficiency is not there. And clearly you're a very adaptable person, because you managed to thrive and grow, and even though you had such a limited bite.
Yeah.
Yeah.
Yeah, I think so.
How old were you when you learned you would need jaw surgery?
So I knew that I had to go through the surgery when I was about 7 years of age. So I knew that I had to go through that process regardless. But as I was saying to Moira, I didn't. I mean, I could have gone to the age of 18 and not have the surgery, but I chose to do because in terms of self-confidence and aesthetics and feeling very uncomfortable with myself, and also other problems like breathing and stuff like that. So I decided to take the journey and go on to do the surgery, because I found that would be the best solution for me.
Who told you at the age of 7 that you would need orthognathic surgery?
Oh, I was living in Portugal back then, so I wasn't in England. And my orthodontist back then at the time advised me to have the surgery done when I got to the age of 18.
You mentioned problems with breathing. What did you find during that first consultation?
Well, I think that when I first met you, I was aware that you developmentally hadn't developed the sternocleidomastoid on one side. And normally when you grow, the muscles play a part in the development of the jaws and the bones. And so where the muscle was on one side and it wasn't being balanced on the other side, growth was moving the jaw to one side, so there was a facial asymmetry. Yeah. When were you first aware of that, actually? What age were you?
It was actually, so I've already started the treatment when I was told that I didn't have that muscle. I was about 13, 14?
13, 14. Okay.
Yeah.
Yeah.
Possibly, yeah, I'm not quite
Yeah.
sure.
And then you came to me when you were, what age were you?
16.
16.
Yeah.
Yeah. Yeah.
Yeah, 16, 17. So.
I mean, I notice that patients, by the time they come into my surgery, have been thinking about this treatment, because it's not like a one operation or a very quick fix. It's a process, and it requires a considerable degree of commitment. So it was interesting because I was chatting to Catarina about this, and I was saying that patients that I meet normally have been thinking on average between 3 and 5 years about the treatment prior to actually ending up in my surgery and seriously looking at the nitty-gritty of what's involved. And actually, it's interesting because you said you'd been thinking about treatment for way before that, because you were aware since the age of 7 that there was an asymmetry, and you were aware that it couldn't be addressed until you'd finished growing. And so if you came to me at the age of 16 and you were aware at 7, I mean, that's a 9-year thinking window before getting here.
Yeah.
You know, so it's kind of a really long process. And so by the time you commit, it's probably in your young life one of the biggest things that you've ever committed to in the short life that you've had, because you're so young, relatively speaking. It's interesting.
You had 9 years to prepare mentally for this treatment. Did you research it?
I mean, I was very young when I found that I, had to be submitted through this, process. And I was just a child back then, and I was very scared at the beginning. I'm not gonna lie, because it's, a scary process. When you're told when you're 7 or 8 that you have to go through something, but because I was, I have 10 years, so I can relax and just think about this if it's really what I want. Because one thing is when you're told by your doctor or your parents, and then so I just thought through it. And when I was older and I got to see Moira, I researched about it. And but I the thing is, I really wanted this really bad, because I had really self-confidence issues. And I wasn't very confident in myself at all. And I always, kids at school are terrible. So, so that what led me to, I need to get this fixed.
We were just chatting earlier, and I was saying to Catarina, and she hadn't really appreciated my observations, because I guess it was the first time that we got to chat about it on an informal level. But I was saying how I'd noticed, I remember very clearly when Catarina first came here and she was with her mother, and Catarina was quietly confident that she wanted to go ahead, and her mum was trying to be supportive, but her mum looked a bit afraid as well. and I was just saying that actually one thing I noticed is Catarina's body language when she first came to me as a patient, and then her body language when she had her operation, and then her body language when we finished the treatment was so incredibly different. The way she held herself, the way she walked into a room. I mean, now you wouldn't mess with Catarina, right? Not that you would mess with her before, but just that the confidence wasn't there. And I always say it's like watching a flower bloom. It was always beautiful, but to see it really in its best form and in its glory. And when I walk this journey with patients, it's roughly a 2-year journey, right? It's a 1.5, 2-year journey, in the middle of which they have surgery. And psychologically, making the decision to proceed is probably the biggest challenge to begin with, right? Mm-hmm. And then once they commit, they're kind of a bit relieved, because they feel like, oh, okay, well, I'm going to do this. I've made the decision. Mm-hmm. And I feel like you guys feel a little bit relieved because you're just ticking along. And then we get the braces on and we start moving the teeth. And that bit's all quite easy. Yeah. And then I start saying to you, well, we're working to this operation. And then patients get a little bit nervous, because then, I mean, how did you feel, say, those 3 months preparing for surgery? Because that's when we do a lot of impression taking, and I'm telling you we're running the surgery virtually, and I'm telling you this, I need to adjust that, and we get closer and closer to the surgery. I mean, how did you feel psychologically in those 3 months prior to surgery?
Yes, because I remember that. Yeah, I remember you telling me, so I need to move this here because of this, because this is how Pete is gonna, do this movement while you're in the theater. So I felt, I felt a bit anxious, because, I mean, it's inevitable. It's a big surgery, and it's, a big deal. But But I think the way you did it, always being transparent about it, always making sure that you're keeping in touch with me and checking on me and how I'm doing, that was really important.
Yes.
So I felt like I had a hand holding me all throughout.
Okay.
So that was really nice and helpful. Yeah.
And then a lot of the time I find just before the surgery, the patients have been so anxious about the surgery, they're just like, just do it. I don't want to worry about it. Is that how you felt?
Yeah, I felt, when it gets to orthodontic surgery, this is it. No turning back now, this is the moment to be waiting for, so just do it. Yeah, definitely, yeah.
And how did you feel, I mean, when you first, I know post-op you're a little bit swollen. I mean, the swelling kind of comes later on really, but when you first looked, what was your experience from a patient's point of view? Once you'd come out of the operating theatre, you'd done this surgery that you've been thinking about for basically 10 years.
So you mean
when you
straight
looked
after the surgery? So as soon as you wake up?
Your first view of this 10-year project.
I don't know, can I be honest?
Yes, absolutely.
Because when I looked at the first moment I looked into mirrors, I've just been straight out of surgery, so I was a bit, so basically I just looked into the mirror and I said, oh, I look just like my cousin. And,
Interesting.
That's what I said to the nurse at the hospital.
You were still on the drugs.
I think so.
No, but I mean, this is a family member, so genetically you're going to have traits that are similar.
Yeah, that was my first thought when I looked myself in the mirror, to be honest.
Did you almost not recognize yourself?
I mean, I was a bit swollen, so it's very hard to, and even sometimes when people ask me about the surgery, I say that I think only after 2 years or a year and a half, it's when you have the complete outlook of what you look like after the surgery, like of the complete, like how you used to be before in terms of your muscles being adapted to your bone structure and everything. So it's not just as soon as you come out of surgery that you look as you did before, but just better,
Yeah.
So it's a whole process of some years after that, because obviously it's still a bit swollen and everything. Although after a month or two, I kind of could, see myself very different, obviously, from what I was before. So
it's interesting how some of my patients say that, if they've been partying, because you young people like to party, and then they wake up and they've been partying for a long night the night before, they look in the mirror and they think, oh, who's there? And then they think, oh, that's me. Do you ever?
That's funny. I thought, because I went, so straight after the surgery, after 8 weeks post-op, I went abroad.
Yes, you did, and I encouraged you to do that, right?
Yeah, that was very important to me to do that. So I went abroad. So the surgery needed to go right for me, in order for me to go. So it did, and 8 weeks post-op, I went abroad, and the people I met there, they used to say stuff to me that no one has ever said before. And I was like, but wait a minute, I'm not that person that you're talking about.
What stuff were they saying?
Specifically,
yes.
I can't remember, but stuff like, oh, you look so, I think general stuff like you look so pretty or beautiful, or I like the way. I'm like, okay, no one has ever said that to me before, actually. And that was very striking, because or qualities, not so much maybe physically, but as you're saying before, when I used to come into your into the consultation room, I was very shy, I was very open, I was more confident, and people would point that out to me, like, I'm not like that. I'm actually very insecure and very shy and very, self-aware. And and that's how people started to see me. And I was like, oh, but then you start subconsciously, you start thinking, maybe that's how I am now. So maybe not that I don't want to say this because this is wrong to say, should I start acting this way now because that's what people think of me? That's not what I'm trying to say. But it is a bit kind of influences you a bit. I'm not going to lie, because the perception others have of you will change inevitably the perception you have of yourself.
Yes, yeah. And I thought it was interesting because Catarina had this amazing opportunity to study in the US. And there was a lot of discussion, should she do it, should she not? And I really kind of encouraged you to do it because I thought it was a great opportunity for a young person to do. And I thought the surgery is supposed to enable you, not hold you back. And that's why I pushed you to go. I said, just go. It's fine. We can finish up, whenever. We'll work it out, whatever, but just go. Because you were a little bit it was a big decision for you as well. But it was interesting because you met new people that had never met you before your surgery, and they only knew you post-op. And so it was just an interesting, social experiment for you in terms of meeting people for the first time with your new face and then getting this feedback, which you weren't familiar with.
Yeah.
And you may have had a different experience had you been interacting with people that you knew before.
Yes, I think...
Isn't it kind of funny?
Yes, it is. I think it is different because even when I went back to Portugal and saw my friends who've known me my whole life, they thought I was... Although I always spoke to them, through text, or we sent pictures to each other, whatever, like video calling, so they could see the difference and they could tell the difference though, and they were, surprised. They were like, even actually, they were, oh, now you look much better. I think that suits you now, or, but they weren't mean about it or anything, so they were really, really nice. But I think more than the people that have known you for a whole life is like the people you meet. And I think that's the thing, that's the difference between, the people you've known before.
Yes, because that was more striking to you, the way they were interacting with you, was people with new people.
Yeah.
And you felt unfamiliar with it.
Yeah.
Yeah.
I think I have to give you a big thank you because of encouraging me to go. And because I don't know what other doctors would do, but I think that, because also I think you knew that was going to happen and that would be important to me. You kept me going. Yeah. So that was really, and I think that was really nice. And we fitted the treatment around. So I was still with my braces on. So it was just standing by and,
Yeah, I mean,
we managed to,
At the end of the day, as doctors, we will always find a solution.
Some doctors don't. I think not.
I'm not, but if it's important for you, it's important for you as a person as a whole, and in your growing up and in your developing. And I just thought, we're not going to hold you back, for goodness sakes. This is ridiculous, Yeah. And in America, everyone has braces. It's like a status symbol. So it's not really a big deal. And you had lovely braces, lovely clear braces. So it wasn't, I didn't really think that was going to hold you back. And we managed to work around. So Catarina carried on and went to America, and we worked around it. And when you were back, we did the adjustments, and then we worked around it, and it was fine. And it was the right decision, I think, don't you?
Yeah.
And I think it's really interesting that now you've chosen a career where you're right in front of the camera.
Ironically.
And I wonder, probably, would you have done that had you not had the treatment, do you think?
No, I think also going back to what you mentioned before in terms of being not so confident and bold before the surgery in what I wanted. And I think deep down, I always felt like I wanted to be an actor and I wanted to act. But because of the other part of me that was holding me back from all of that and not to be as confident and bold to, say that out loud, and express that out loud to say, yes, I want to be an actor, I think that with the surgery, without the surgery, I wouldn't have.
You wouldn't have fulfilled an ambition that you feel like you always had inside.
Yes.
Yeah.
I think that it really helped to trigger it, and this is it now.
Yeah. I feel so happy to have walked this journey with you, and to see this transformation for me is just an absolute joy. Every time I see you, I feel so happy that we've managed to get you to where you are. And, you know, for you, obviously, it's a pleasure to go through it and transform. But for me, it's probably equally a pleasure. You know, and we always have a good time when we meet each other.
Yeah, we do.
Yeah, I always like to catch up, and I was very nosy about what she's doing with her time.
Yeah, I think.
What are you doing now? I'm really excited to hear. So,
I think that's the other side of having her as a doctor, is that she doesn't only care about you as a patient, but also as a person, an individual, and taking your life outside of this consultation room into account, like you did with me in America, and also, you know, and caring about your patients. And sometimes we overrun a little bit. There are people waiting on the waiting room.
I know, because we're talking too much.
But that's part of, you know, it's not like you come here and you do, okay, you're done, bye. No, you're not like that. And I like that in a doctor.
Yeah. I think we'll always continue to monitor you. I'll always be nosy and ask about, you know, when you get married and you have kids, and I'll be always kind of, because it is quite a, I don't know, it's a long journey, and it's quite a special thing to share with someone.
Yeah, definitely.
Yeah.
And can you describe in detail the actual process you went through, step by step?
It's about a 2-year, if we just round up the numbers, on average, it's a 2-year process. It ranges from 1.5 years to 2 years. About halfway through, you have orthodontics for, say, 9 to 12 months. Then you have the surgery, and then you have orthodontics for, you know, another 6 to 9 months afterwards.
Mm-hmm.
So that's kind of the process on average. It varies a little bit between patients, but it was roughly that, wasn't it?
Yes, I think I wore braces for about a year before the surgery.
Mm-hmm.
Yes.
Yeah.
So those are the timings, I think.
How would you describe the pain on a scale of 1 to 10?
In terms of pain during the surgery, I mean, when I was recovering, it was about 7, 8, or I'm very, in terms of pain, for me, I take pain really well, unlike most people. Like, if we speak, I don't know, someone close to me, for example, my mom, she probably like something like this with a needle, she will jump, but I'm not like that. So it depends from person to person. So I'd say, yeah. But for me, that's how I took the pain during the surgery. And I had, you know, of course, you always have painkillers and stuff like that to help you through. But for me, it was between 7, 8, probably 8. Like after, but I don't remember it was more uncomfortable and really uncomfortable sleeping, standing up in that position. It was more painful in that sense that I couldn't, you know, because obviously if you go backwards, you'll have a whole of the blood will go into your swollen face, and that will be painful. But because I was sleeping straight up, and then I took lots of painkillers because I took them, because there's several. There's one to help, and then there's the strongest ones that you just take.
Little straw in the bottle, the codeine.
Yeah, codeine. Yeah. So I took that in for a couple of times when it got a bit worse. So probably that's why I didn't feel as much pain, because it really helps with pain. Also, you should only take that in very extreme. Yeah.
How long did you have to sleep sitting up for?
First month, I think, for a month. Yes, 3 weeks, 4 months. Yeah, 4 weeks.
If you can go back in time knowing what you know now, would you have the surgery again?
Yes. Yeah, definitely. because after like the surgery, like the lifelong benefits you get from doing such a jaw surgery. I know it's intense and there's a lot happening and going on, but it's worth it. Because if you think about long term, I'm very young, so in my 20s, and if I think about like just these 3 years in comparison to my whole life ahead and the impact I will have on my whole life, it's worth it. It's not
After the surgery, did you find there was something you wish you knew before you had the surgery? Something that no one could have told you?
No, I think I've been told everything, because I think again Moira and Pete were very, very clear and transparent with me in everything. Especially Pete was very blunt in every single aspect of the surgery. He didn't lie to me. No, but that's very important to have that as because I don't like when doctors go and be like all flowery and rosy, because it's not. You feel pain, you feel this, you feel that. He was very straightforward with me. He was like, "Are you sure you still want to do this?" And I was like, "Yes, 100% sure." So he was very, very straightforward. And I think at the end, having that and not being, told things that won't be happening because of the, nature of the surgery. And so, yeah, transparency is everything. And I had that from my doctors. And also I spoke to people who've gone through the surgery themselves and to help me through, their own personal experience. So that was really helpful as well.
We have a buddy system in the practice where patients that have undergone the treatment, we always ask them, if someone else wants to contact you to talk about the treatment that you went through, would you mind? Kind of pay it forward system. And a lot of the patients are absolutely open to doing that. They don't, maybe one patient will help another patient, that one patient will help another patient. And so one of our patients, who happens to be an eye surgeon, we have many doctors here, which is kind of flattering, really. But Anna had double jaw surgery, and she presented with also a facial asymmetry. She had the details of her surgery was slightly different, and the cause was slightly different, but the surgery itself was similar to what Catarina was going to go through. And so I asked Anna, would she mind speaking to Catarina? And you guys got together and had a chat about things. Yeah. And so this is when Anna had fully completed her treatment, and Catarina was just about to start.
What did you ask her?
I ask her, I think most, the questions that most people have, how is the process of going through jaw surgery? How long does it take? When are you going to be able to see the results? Are you going to be very, very swollen? Are you going to be able to drink and eat straight after that? Not eating, but I think eating is just after a week you can eat mashed stuff for 2 weeks, but it's mostly liquids and through a straw. And although I think after my second day or third day, so when I came back from the hospital, I was already going through soups and stuff. Yeah, so it was very. I had a really impressive recovery. I think I could say that, because I think by the second day I was already up and walking around the hospital, and I could open my mouth a little bit, and I could eat mashed stuff and drink after a week or 5 days ish post-op. So it was slow, but it wasn't as slow as as just drinking milkshakes or water or liquids. It's not like that. You can, again, or you do what is comfortable for you. So each person is a different person. Each experience, it will be a different experience. So
I'm going to ask you the question that every woman has in her mind right now. How much weight did you lose?
I think I was a bit heavy before that. So, so I lost about 6 kilograms. I don't know how much that is in pounds, but 6 kilograms, 5 kilograms. To be honest, I didn't lose as much as I thought I was gonna lose. To be honest, I don't know. I was a bit heavy before that, so I kind of.
I think you're slimmer now than you were.
Yes.
Like, because you've maintained.
Yeah.
Haven't you, since?
Yes, I did, but also I had other things going on that I also had to treat, and and that's why I lost it. But you're right, I am.
Right, I mean, I think you look great. Yeah.
And did your speech change after the surgery?
Yes, it did actually. I used to be, I think sometimes I still am a bit but I think before I used to be way more. And in terms of, because I love singing and I sing sometimes, in terms of like, I don't know, it kind of opened my throat a lot more and my voice got deeper, I think. I mean, it was very low voice already, but I think it got way deeper because it kind of opens the throat. And that's another thing during jaw surgery. It also changes because your breathing is connected to your jaw and everything. Correct me if I'm wrong.
Yes,
but I'm not a doctor, so. But also it changes because moving the jaw forwards or backwards, it will change your nose a little bit, so you can, correct all of the breathing problems as well. And so, in a way, what I feel is with me, it opened the back of my throat probably a little more, so it has more space to the, voice changing and everything. I don't know, maybe more helps.
So in Catarina's case, we moved the upper jaw forwards. And when you do that, it changes the support for the nose. Mm-hmm. We don't work on the nose, but the nose sits on the upper jaw. Mm-hmm. And so there's an impact in that the nose is better supported. We brought the lower jaw back a little bit, and then we corrected the asymmetry. And there was also a little bit of asymmetry in the upper jaw in terms of the cant. Mm-hmm. And so we corrected that as well. When you bring the upper jaw forwards, you open up the airway at the back, and the flow of air is coming through a larger volume. And so the flow is easier. It's not so restricted. Okay. One of my patients, where we brought the jaws forward quite a long way, first thing she said after surgery was, Dr. Wong, I've been breathing through a straw all my life. And I said, but I asked you if you had any breathing issues in the questionnaire, and you always said no. And I asked you lots of times, and you said no. And she said, but I didn't know because I had nothing to compare to. And so this is interesting how correcting the position of the jaws impacts, yes, aesthetically, massive difference, massive impact, but just quality of life in terms of, she never did gym at school because she said she couldn't breathe. So mum took her to the doctor, and he said she doesn't have asthma. She doesn't have asthma. She has no problem with the lungs, but between the lungs and the outside world, the airway was restricted. And so the air coming in and out was rushing in, rushing out, rushing in and rushing out. And when we'd opened her up, she now jogs around Hyde Park. Her mum doesn't recognise her because she'd never do anything that was strenuous. But because she said, I can breathe now.
On that note, I actually have something to say about me personally, is that when I used to run out of breath, like jogging, I used to run out of breath completely. And that was weird because I couldn't jog for 10 or 15 minutes without running out of breath. So I would give up on jogging, But then also during sleeping or even just being quiet like this, I would tend to go and breathe through my mouth instead of using my nose like I do now. And and even, I don't know if your tongue is involved in your breathing as well, or the way you breathe, but I used to rest my tongue in the bottom of my teeth instead of the up, and now I rest on the upper teeth instead of the bottom teeth as well.
Yeah.
So those were some differences on top of everything else that I realized with the surgery.
Is there something you think people should know if they consider jaw surgery treatment?
So I guess the only thing that's interesting is the recovery. So as far as I understand, my feedback just from a lot of patients, just as a general, is week 1, post-surgery, have the surgery, first week, you up and about around about day 2. But generally I find patients week 1 is probably the hardest.
Yes, definitely.
Because you're swollen, you're managing your pain. We do supply really good drugs and and you know,
not those ones.
not those ones, legal drugs. And so pain can be managed. And then week 2, my patients are going shopping in Westfield and doing stuff, and I'm saying, be careful, because I don't want you to bump into someone or affect the surgery. And then week 3, one of my patients went back to operating. Anna was operating on eyes in week 3. What were you doing week 3 post-surgery?
I can't remember very well. Also, it was holidays, so I was probably like relaxing
because
yes, and preparing everything to go abroad. Because I think it was very impressive though that by 8 weeks I was on a plane to start life somewhere else
in a new country and a new place that she's never lived in before.
Yes, so I think that was really impressive, to be honest. With no setbacks to the surgery or anything like that. So even Pete was a bit, as a good surgeon, concerned that he didn't want me to go jogging or do things that could risk myself potentially, because he wouldn't be around to.
The surgery is very precise. We spend a lot of time planning the surgery, planning the tooth movements, and so once we've done the surgery and everything is perfect to the millimeter, we don't want them to bump into someone and damage the work that we've spent many man hours planning, preparing, and then executing. So from our perspective, we're always very anxious about the patients, but I think that as long as the patients are sensible, and Catarina, you've met her, she's clearly a very sensible person, it's fine. My 60-year-old patient started riding horses.
Yeah, that kind of thing.
After 3 weeks, and I didn't tell Pete because I thought it might make him angry, but I said, if you fall off the horse, it undoes everything. But he apparently was a good horse rider and everything was fine. So, it is within reason, but actually Catarina is very sensible, and I knew that she wasn't going to put herself in an environment where she could get knocked or inadvertently. And so it was all fine, right?
Yes, definitely. I mean, nor did I want it to get knocked and to go through another surgery again.
Yeah,
so.
It's the worry of trauma is our concern, really, post-operatively. Yeah, but in all the years, I've been working with Pete since 1998, and we've never had a patient had a trauma, although that's what we worry about after surgery.
You said you love singing. Can you sing something for us?
Come on, babe, why don't we paint the town? And all that jazz, I'm gonna rouge my knees and roll my stockings down. And all that jazz, start the car, now a whoopee spot where the gin is cold but the piano's hot. It's just a noisy hall where there's a nightly brawl and all that jazz.